So hello everyone, this is Ashish from the CSRUniverse, and we have today a very special guest, Dr. Janhavi Nilekani. She has started her own initiative in healthcare sector. She's in social development, and she started it more than 5 years back. We are here to just understand what she is doing, what is the intervention she's trying to make here, and how her journey has been so far. So, you're
Thank you
welcome.
for having me.
So, how this whole idea of Aastrika started?
I've always been passionate about being in the development sector. I was sure of this for a very long time from when I was a teenager. My whole family is in it, and I was inspired by that as well as certain other things. So I pursued my studies at Yale and Harvard in development economics mainly. I used to do a lot of work in air pollution. I was more focused on environmental issues initially. But during my own pregnancy, I realized what the poor quality of care is even in the cities for Indian women. Of course, I was already aware about our high maternal and infant mortality rates, but I had not realized how poor the quality of care is even at the even for the better off segments of society. So I think that inspired me to shift from a focus on air pollution and environmental health to maternal and child health, and that's what got it all started.
Okay, all right. So, Janvi, you have studied in Western countries, and you have seen how the social development sector is there. What kind of basically the basic issues that are there, and in India, there would be different issues. So, when you compare, how do you see what is the difference in terms of the kind of problems that exist and the kind of solutions and interventions that people are trying to make broadly?
I don't think that is in terms of problems. Well, if you look at just the US, right? Let's not, every country is different. Since I lived for a decade in the US, I'll speak about that. In the US, maternal and infant mortality rates are obviously much better than in India, but they have still seen a rise in maternal mortality rates over time. They have strong, their NCD burden is worse than us. Obesity, high blood pressure, diabetes, their NCD burden is much worse than us. So they are a little more, they need more focus on controlling NCDs in pregnancy. And I mean, okay, their quality of care though compared to us is still a lot better. In India, I think two challenges. One is adequate care is not there everywhere. Some people there's a lack of access to healthcare facilities or professionals, or drugs or infrastructure, or ambulances, and at the same time because we have really a lot of over intervention. So c-section rates in America will be 32%. Private sector India is 48%. There are states where c-section rate in the private sector is 85%. That is a shocking amount of unnecessary surgery. This is not such a problem in the US. They don't go around as much operating for no good reason. They do it in some places, but much less than India. We also have a lot of disrespect and abuse in labor rooms, which is not really present abroad. There, the emphasis on informed consent is much, much, much stronger. That is on being treated humanely. So that is some of the challenges here. Solutions, I think, are actually not that different. Improving quality of care always means upskilling your healthcare professionals. So that I think happens is similar in both countries.
Right. So, Janvi, when you see the infrastructural facilities that are available in India, right, and that available in different other countries, right, and the kind of intervention that you are trying to make, so where do you think that you will be able to make a difference when you do intervene into this sector now?
Yeah, we hopefully do think we are making a difference, partly through advocacy work and increasing emphasis on this challenge. A lot of our efforts are in establishing a cadre of professional midwives, along with many collaborators who are here today. But Karnataka in particular, we are the primary partner and funder for the National Practitioners in Midwifery NPM program. And then we do work on capacity building, especially competency based education throughout the country, with a special focus on, I would say, UP, Bihar, MP, and Karnataka as of now.
Right. So, Janvi, just wanted to ask that last 5 years has been a journey that you have taken for this Aastrika Foundation, and the time you would have started after a year or two, COVID would have hit the country, I mean, everywhere. So, how difficult it was in the early days to like cope, and because these the kind of work that you do, it requires on ground activities, right? So how did you cope up? What was your strategy then to continue your work? And now, what is the difference you see in that 2 year and now that you are working?
Um, We kept it simple. During the COVID years, we prioritized building out our online and digital programs so that by the time COVID is over, those were on a solid base, and we were able to therefore then after that pick up on in-person things. So that we were.
Right. So, Janvi, you are coming from a family which has always been working on a social sector, and Aadhaar is basically now the foundation of everything that happens in India towards social inclusion, right? So, I was just curious before this interview, when did you first come to know about Aadhaar, and what was your impression towards Aadhaar when your father was working on that project?
I was an adult then. I mean, I was grown up. Yeah, 2009.
You knew how it is going to what it is going to do with people.
As soon as anybody else knew. I'm not saying I had private information, but
Right.
I was a grown adult so of course I read the news and all. I mean, yeah.
Wonderful.
What is the questions?
Yeah. So I was just trying to ask that.
I think we would have found out at the same time. I was anyway living abroad, so I don't think I got early information, if that's the question.
Okay. All right. So your foundation's name is Aastrika. What does that mean?
So it's Aastrika. Astar means expansion. Urmika means wave. And we joined them to make Aastrika because 3 is also in there. It's the idea that our work will create a wave of change, particularly for women.
Wonderful. I read somewhere that you have taken a huge target of 25 million something by 2030. What is that target, and how far you have gone so far?
Well, there are 26 or so million births a year in India. So the logic of 25 million was like every birthing woman. Of course, we're nowhere near that number. But yeah, if you can cover large states like UP and Bihar, you have got quite some way ahead.
So how far you have reached so far, and what is your plans for next 5 to 7 years when you are planning to reach that number that you have targeted?
The only way you can really reach the whole country is actually through your advocacy work. It's through making a change so that health institutions and policymakers and governments across India feel that they need to improve. No organization or even a few organizations can scale across the country. What we can do is reset aspirations so that medical colleges and hospitals nationwide themselves feel that they need to improve. So that's our plan over the next several years, is to inspire more people, among other things.
Right. So Janvi, in this sector, particularly in social sector, NGOs struggle a lot, right? For you, how has been the journey? I'm asking in terms of getting funds, mobilizing resources.
No, of course, I don't think, I mean, we are self-funded, so it's not a typical situation at all. It's consciously been set up as a self-funded NGO. And of course, we've been in this, as a family, we've been doing this for 25, 30 years. So it would not be appropriate to ask me. I don't have the typical background of someone setting up an NGO. So one of the reasons I went down this route is I knew I had comparative advantage in this space.
Right. Thank you. Wonderful talking to you, and I wish you a lot of success.
Thank
Thank you.
you. Thanks.